Please stand and put our hands together as we welcome Yang Berhormat Menteri Kesihatan Tuan Sari Jamaluddin to our event at the MMA House today. Welcome, Tuan Sari. And when we speak of heroes, we also think of one particular force to reckon with. We have also just been graced by the presence of our Director General of Health, Tan Sri Dr. Noor Hisham Abdullah. Welcome, Tan Sri, to our virtual platform. It's an honor to have you here celebrating this day with us here today. And thank you also to the media for being here today. Next, I would like to call upon our newly minted and admirable President of the Malaysian Medical Association, Yang Berusaha, Dr. Pul Kachai, to come on stage to say a few words.
Very warm, I think it's afternoon, yes. Sorry. Today has been a very hectic day for all of us here, and including our YB who has rushed all the way from Pengarah to join us today. We're very thankful that he's here. So, Yang Berhormat Tuan Sari Jamaluddin, Minister of Health Malaysia, Yang Bahagia Tan Sri Dr. Noor Hisham Abdullah, who is here online, is the Director General of Health of Malaysia. Dan Yang Bahagia Datuk Harjit Singh, Timbalan Ketua Setiausaha Pengurusan. Yang Bahagia Datuk Dr. Suresh Kumar Cigambaran, General Physician, ID Physician from Hospital Sungai Buloh. Yang Berusaha Dr. Rohana Johan, Pengarah Kuala Lumpur General Hospital. Yang Berusaha Dr. Anas Alam Faizli, CEO of Private Health Corporation Sendera Berhad. Yang Berusaha Dr. Salina binti Abdul Aziz, Head of Psychiatric Services and Head of Psychiatric Department Hospital Kuala Lumpur for Psychiatry. A very good afternoon and a warm welcome to MMA House on this special occasion. Today is our day, Doctors' Day 2021. As we stand here on this auspicious day, we reflect on how many of our fellow doctors have fallen during the course of this current pandemic. It has been a difficult time for us doctors, both in the public and private sector. We have many who work through long hours with little rest, sacrificing time with loved ones. We see our government doctors stretched thin at the front line, facing a never-ending stream of COVID-19 patients. Apart from physical exhaustion, doctors had to deal with mental and emotional stress from losing patients to COVID-19. Hence our theme today, healing our healers. As we doctors too need the inner strength to continue giving our best. So, to our doctors, we never give up. We stand true to the process. It is hoped that we will never break. This is a wish for all our doctors on this Doctors' Day. The private GPs have played a major role in helping to contain the spread of the virus, especially in the mass testing of foreign workers, community testing, as well as their participation as vaccinators under the National Immunization Program. The National Immunization Program has been a great success, and we wish to congratulate the Honourable Health Minister, who was and still is the Minister in charge of the program. As of this morning, 89.7% of the adult population have been vaccinated. Hitting 90% today on Doctors' Day will be a meaningful achievement for all. Let us apart from the vaccinations and the SOPs, it is imperative that we take all necessary steps to ensure we are in the best of health as we transition into the endemic phase and coexist with the SARS-CoV-2 virus. This is why we are encouraging the public to come forward for basic health checkups through our free medical camp held today, to emphasize the importance of regular medical checkups as one of the basic steps in taking care of our health and preventing diseases. Kudos to the team that worked hard organizing the medical camp today. MMA is indeed pleased that the government is giving more emphasis to reforms that are needed in our healthcare system. COVID-19 has brought to light many areas in our healthcare system needing urgent improvements. We hope that the coming budget for 2022 will address many of these concerns. We too hope there will be good news soon for our junior doctors, in particular the contract medical officers who have waited years for a solution to their issues. We are thankful and hopeful at the same time, as our health minister has made this issue a priority to resolve. Our junior doctors are the specialists of the future. Therefore, we must ensure we support their career pathway. We need to grow our pool of specialists, and it needs to start with reforms in the system. Lastly, we hope that more public-private collaborations will be explored. The pandemic has stimulated ideas and discussions on this. We have also seen government programs like the SOXO mass screening of foreign workers and the vaccinations under the National Immunization Program run successfully with the private GPs, as well as referrals of non-COVID-19 patients to private hospitals when public hospitals were overwhelmed. We do look forward to increased emphasis in primary care. If patients are managed early at the primary care level, more comorbidities can be prevented and government healthcare costs reduced. Before I end my speech, I wish to say that the Malaysian Medical Association stands firm in its commitment to reforms in the current healthcare system of Malaysia. Thank you.
Thank you very much, Dr. Kokachar, for your inspiring message. Can we ask for everyone to observe a 1 minute of silence for all our fallen heroes? A shout out to Happy Peter's production, who enabled us to sit back and reminisce what our year has been with a short video tribute to all our frontliners.
December 31st, 2019. China alerted the World Health Organization to several cases of what it called unusual pneumonia in Wuhan, a city of 11 million people.
Dua kes baru 2019 novel coronavirus dilaporkan ke Crisis Preparedness dan Response Center CPRC Kebangsaan pada 3 Februari 2020.
When COVID first hit us, I too was struck with fear. For the first few months, I distanced myself from my family. It was exhausting to be careful all the time. The mental and physical stress There was no end in sight. The worst feeling is feeling you are stuck somewhere indefinitely while the world moves on. It was stretched far too deep.
I wondered, was I gonna die from this?
Next up, live streaming from the Hospital Duchess of Kent, Sandakan, representing Junior Doctors of Malaysia, I would like to call upon Dr. Natasha Suraya to share her sentiments as a young professional called to service.
Thank you so much, Dr. Lynette, for the introduction. YB Tuan Khairi Jamaluddin, Datuk Dr. Noor Hisham Abdullah, Dr. Suresh Kumar Chidambaram, Dr. Ko Kar Chai, Dr. Salina Abdul Aziz, esteemed guests, all my colleagues and friends, I bid a very good afternoon to everyone. Hi, I'm Natasha. I'm a houseman currently serving in Hospital Duchess of Kent, Sandakan. Currently my 6th posting in the emergency department posting. I'm very honored and grateful to be here today as part of the Malaysia Doctors Day as well as the Mental Health Day hybrid celebration organized by none other than our own MMA Malaysia committee with the theme of 2021 Healing Our Healers. Today, I will be humbly speaking on behalf of all the junior doctors throughout Malaysia. Truly, this year has been a grueling year for everyone. Not just the junior doctors, as senior doctors as well, and the staff nurses and MAs and everyone in the healthcare fraternity. With COVID cases dwindling down early in the year, we suddenly see a sudden rise in cases in the middle of 2021 in July, where cases were reaching 5 figures, and now we are slowly climbing down to 4 figures, and hopefully the numbers will go down to single digit or 2 digits by end of the year. I'm sure it has been very, very challenging for everyone, but coming from junior doctors' point of perspective, we have faced, we were also in the front line having faced losing our patients on a daily basis at our own centers, having to choose patients who to let go, who to continue supporting, to also losing our own family members. I have a story whereby I have a colleague who was working in Tawau as a frontliner in COVID, whose mother passed away back in Peninsula, but couldn't make it to the mother's funeral due to logistic issues and also due to travel bans and all. So these are some of the challenges that we had to face as junior doctors, working in the front line during this COVID pandemic. Other than that, we also had cases where junior doctors and MOs had to be posted to other hospitals within very short notice. I have a senior in HDOC Sandakan here who had just 2 days to be transferred to Hospital Tengku, Hospital Tentera in Sungai Besi within just 2 days to serve in Hospital Medan, as there was shortage of a number of doctors back in Hospital Medan, and she came back here just recently after 3 months serving there while waiting for her permanent placement in Semenanjung. Despite all these struggles that we are facing, alongside with our senior colleagues, we are very grateful and very proud to have been part of this journey, as we are also learning, and we get to be having our hands-on experience together with our senior colleagues, learning new things every day. As you know, COVID, every day it changes, and every day there is some new discovery that has come about that we have to change our practices. It's a very fast-paced disease, as Dr. Suresh has mentioned as well, coming from the ID physician side. Now that the cases are becoming more in control, though, as part of the junior doctors community or fraternity, I would also like to highlight and take this opportunity to shed some light onto the plight of our junior doctors' journey. Ever since 2016, when I was still a medical student, we've had this issue, the elephant in the room, the unclear specialization pathway, and also the permanent post criteria selection pathway, which have seen the course through many different governments of Malaysia. However, up till today, we have still not seen any solution or any clear light at the end of the tunnel. So with great hopefulness from and on behalf of all the junior doctors of Malaysia, we would like to urge the Ministry of Health to look into this matter further and possibly have a roundtable discussion with MMA and also maybe the junior doctors to come up with solutions, as we know time is running out for the first batch of the junior doctors who have just will be finishing their contracts soon. We hope to see some solution or some clear guideline by the end of 2021, hopefully. On this note as well, I would like to urge the medical fraternity to come together as one in combating all these issues that we have in our medical fraternity, the way COVID has united us all, as there is no better time to do so. As a closing remark, I would like to wish all doctors happy Doctors' Day, and may you heal with the nation. Thank you.
Equality in mental health service regardless of boundaries, and the rights of every individual to good mental health service, as well as accessible by anyone, anywhere. So, during the World Health Assembly in May 2021, governments from around the world recognized the need to scale up quality mental health services at all levels. Yet, it causes a lot of optimism. In some countries, they found new ways of providing mental health care to their population. With regards to now what's happening with the pandemic, COVID-19, a senior psychologist, Peter Candy said, there are three parallel pandemics happening now actually. One is the global recession, where the pandemic, where everybody is losing their job, having insecurity in the job, and this has impact on your mental health. The second pandemic that's going on is the influenza pandemic, the COVID pandemic. This is also having an impact on mental health. We have listened just now to what's happening to the doctors, and from all the healthcare workers talks about being burnt out and exhausted. And the third pandemic as yet to come is the tidal wave of mental health issues happening, where people are experiencing significant level of mental health issues. The enforced social isolation due to the pandemic has affected people around the world, where socializing with friends and family is discouraged. We are living in a culture where we like to socialize, and now it's been discouraged, and at times it's punishable. So you go and socialize, you're being punished for it. Thank God, I heard today that we now can travel. I hope that's true. So this has led to a lot of motivation problems, sleep, and it can increase anxiety and depression. We have been forced to work from home, some of us, changing our schedules and routine, and learn new skills, especially with teleconferencing, Zooming, and some of us are too old for this. Some of us are too old, especially getting used to computers. Actually, social isolation, working from home are just examples of where the pandemic has affected us mentally. And mental distress, that is a state where the problem affects our thinking and our feel and how we behave. Mental distress that occurs during this pandemic, it is on the backdrop of already a high prevalence of mental illness and also a high prevalence of substance abuse. So, as I mentioned just now, there's going to be a big wave of mental health issues that will come out, with regards to COVID pandemic. In our everyday life, we also see some of this in our newspapers. Things like a total of 9,000 cases of domestic violence were recorded among community during the MCO, and Social Welfare Department recorded 2,040 cases of abuse against children in the 4 months between January to April this year. So we did a study actually. We did a study, a long-term study on neuropsychiatric complication. It is an online survey to those who are infected by COVID previously. So far, we had 3,000 respondents, and the initial analysis of about 2,000 respondents showed that 25% suffered from at least moderate to severe depression. 25% of those who answered our questions. Okay, 20% had anxiety, 20% had PTSD, post-traumatic stress disorder, and 37.5 had cognitive impairment. Okay, cognitive impairment means problems in your thinking. Okay? This is a very, very, very worrying finding to us actually. As of yesterday, you open your MySejahtera, there is 2.3 million confirmed cases of COVID-19. 2.3 million, maksudnya di sini, if you postulate, if you calculate, 25%, how many of them will be having depression? That's nearly 500K. So 500K people will be having moderate to severe depression when you postulate from this study. But we have yet to do the whole analysis to come up with the statistics. WHO has already given us guidelines on how countries we can maintain the service, including our mental health service. We have tried during this pandemic. What we did was we made an online consultation. It was a necessary innovation. So, unfortunately, our health facility, some of our health facility are not prepared. Whether it's with regards to equipment or with regards to financial to move to this stage of giving services. So hopefully in the future we will be able to do this. I have a lot more to say actually, but time is precious and limited. We are amidst a global crisis that is resulting in a widening health, economic, and social inequalities. So 2021 World Mental Health Day provides an opportunity for every one of us to come together and act together to highlight how inequality can be addressed to ensure people are able to enjoy good health, good mental health. So let's act together, let's be a partner, let us advocate for mental health. Thank you very much.
Thank you, Dr. Salina, for the inspiring speech. Being no stranger to the plight of the profession and the race against the pandemic, having served as the coordinating minister of the COVID-19 National Immunization Program, and now leading us at the forefront as the Minister of Health, let us put our hands together for Yang Berhormat Tuan Khairi Jamaluddin to deliver his address.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh dan salam sejahtera. Apa aja Datuk Haji Timbalan Ketua Kementerian Kesihatan Malaysia, Dr. Kachai, Presiden Malaysian Medical Association, Dr. Salina Abdul Aziz, Head of Psychiatric Services and Head of the Psychiatric Department, HKL. Seterusnya adik-adik MMA, Dr. Anas, CEO Protect Health Corporation, seterusnya tuan-tuan dan puan semua yang sedang mengikuti sambutan ini di alam maya dan Sri Dr. Hisham, rakan-rakan yang berada di seluruh negara. Pada jam 12 tengah hari tadi, saya telah menghubungi Yang Amat Berhormat Perdana Menteri untuk memaklumkan bahawa kita sudah pun mencapai 90%. Dan dengan itu saya telah maklumkan kepada Yang Amat Berhormat bahawa Perdana Menteri boleh umumkan bahawa pentas negeri dibenarkan berkuat kuasa. Ini adalah satu milestone yang sangat-sangat penting, bukan hanya untuk mobility dan sebagainya, tetapi untuk kesihatan mental Dr. Salina. Sebab ramai keluarga Malaysia yang terpisah selama 1 tahun lebih, tak dapat bertemu dengan ibu bapa, dengan sanak saudara, dengan sahabat handai. Dan kita tahu bahawa sekatan ini dibuat kerana kesihatan awam. But we deliberated at length. Of course, with the Delta variant, there's no such thing as an easy calculation as to what herd immunity is. Some people even think it's irrelevant with the variants that are out there. So in many ways, 90% is not a threshold or a scientific threshold for herd immunity. But it's when the government felt that there was a wide enough coverage of immunization for the adult population. Dan kita pun tahu bahawa semenjak 3 minggu yang lepas, we have started with the adolescent vaccination. 65% of our teenagers have received at least the first dose. So we felt the time was right, because if we kept the state borders closed, we would inflict bigger, not just economic costs, but also a cost on our mental and physical well-being. Sebab itulah kita alhamdulillah hari ini telah mencapai nilai ambang yang telah pun kita janji dan kita umumkan. And of course, we went one step further. We said for those Malaysians who want to travel abroad, of course some of them have families abroad, we've not seen them for years. Sebelum ini kena mohon melalui immigration, my travel pass, and we've lifted that. Anybody who wants to go abroad now can go abroad, but you still have to quarantine when you come back. Dan ini adalah saya rasa pengumuman yang sangat tepat pada tarikh ini. Tarikh ini iaitu 10 hari bulan 10. yang mana kita sambut Hari Kesihatan Mental Sedunia dan juga kita sambut Hari Doktor Malaysia. Dan saya rasa pengumuman daripada Perdana Menteri adalah sebenarnya satu penghargaan juga kepada barisan hadapan doktor kita. Since we reported our first COVID case in March of 2020. It has certainly been a long journey, and of course, as the video that was prepared said aptly, we have still not won the war. We still continue. We're still not out of the woods. Dan saya ingin tekankan bahawa walaupun rentas negeri dibenarkan, kita harus sentiasa mematuhi kepada semua all the public health measures which are still in place. Doesn't mean that the SOPs are gone. In fact, we must continue to observe the SOPs even more strict, even more widely, and we must ensure that we remind others that they must also adhere to the SOPs. This is because, of course, sebagai Menteri Kesihatan, saya juga suka melihat sempadan-sempadan negeri dibuka. But of course, every night I worry. I worry because we don't know how this SARS-CoV-2 virus behaves. It's a novel virus. We don't know how it mutates. We don't know how it behaves, what it's likely to do next. Dan yang lebih penting, we also don't know how Malaysians behave. I think that's the main thing. So I know that everyone is going to be rushing to the border tomorrow. But at the back of my mind, of course, sebagai Menteri Kesihatan, my biggest worry is another wave. And that is not something that is out of what is possible. You look at some of the countries now who have high vaccination rates, similar to ours, 80%. But they are undergoing a new wave of infections. Walaupun kes-kes baru mereka 95% ke atas adalah kategori 1 dan 2, mild or no symptoms at all. But you must remember that if the bottom of the pyramid is bigger, the top of the pyramid gets bigger as well. As the number of infections grow, if it's 98% category 1 and 2, the 2% in the category 3, 4, 5 gets bigger in terms of the absolute number. And my biggest indicator is, as you know, not so much the daily case numbers, but it's the stress on the public healthcare system. That is my biggest worry. Kalau public healthcare system kita tidak boleh menangani the surge in cases, ICUs, ventilators, oxygenated beds, and of course, admissions into hospital in general for COVID-19, then it's going to put a tremendous stress, not just on the public healthcare infrastructure, but also on our frontline workers, our doctors, nurses, the medical assistants, and everyone else working to combat this pandemic. We cannot afford that anymore. Jadi saya telah dengan Kementerian Kesihatan membuat persiapan awal untuk memastikan bahawa we can deal with the surge if we have to. But we don't want to deal with the surge. We don't want to deal with the surge. And today, of all days, on Malaysian Doctors' Day, kita minta kepada rakyat Malaysia, now the responsibility is on you. If you really, really value and if you really, really appreciate what the frontliners have been doing for the last 1.5 years, you will be responsible. You will be self-aware. You will ensure that you will take care of your health and your health status to ensure that the surge doesn't happen again. It's all well and good saying thank you frontliners, but if you don't adhere to the SOPs and if you engage in high-risk behavior, then your words of appreciation to the frontliners are merely lip service. Now it's up to you. We've given you now the freedom and also the advisory guidelines and the tools for you to look after yourselves. If you become sick, of course, KKM is there for you. But now it takes the whole society to ensure that we can transition out of this pandemic, reopen safely, and one day we can treat COVID as an endemic disease. Not yet. We are far from endemicity. Don't get me wrong. We are not even endemic yet. We are transitioning out. So remember, trace, apa yang disebut oleh Perdana Menteri tadi, test, report, isolate, inform, and seek. Apart from mask wearing, apart from avoiding crowded places, apart from physical distancing, sangat penting untuk kita amalkan trace test if you're symptomatic. If you have any of the common symptoms of COVID-19, persistent cough, the loss of sense of smell, taste, sore throat, etc., then test. Now the tests are available, the rapid test kits, and we are working towards fixing a lower ceiling price so that it becomes more affordable for people. Test. Second is report, report. No matter what the test result is, positive or negative, report. If it's positive, of course you must report. Negative also, you must report. So we have the right denominator to ensure that we know what the positivity rate is. I is to quickly isolate if you're positive. Don't ask too much questions. Positive on the RT antigen saliva test, we take it as a positive. Now go and isolate at home. If you don't have space at home to isolate, go to the CAC and we will find a quarantine center for you. I is also inform. TRIIS. Inform. Inform who? Inform your close contact. Last 5 days, your family, your friends, your colleagues, who you've been in touch with, so that they can do self-test. They can do self-assessment. And also, if you're having symptoms, then please inform the CAC, so that the CAC will do an assessment whether or not you can self-isolate at home or whether or not you need to be referred to a PRC in the hospital. S is seek. We don't want to see any more BID cases brought in death. And this is for cases, people who are isolating at home, don't even know that they are sick. Suddenly there's an escalation in the symptoms and they pass away. So health-seeking behavior must be there. If your symptoms worsen, then please seek medical help. These are simple guidelines for us to understand, to digest, and to practice. Sekiranya kita nak melihat bahawa dengan adanya kebebasan yang kita ada pada hari ini, esok dan seterusnya, we can become a COVID resilient country. We can not only live with COVID, but we can overcome it. One day becomes an endemic condition in our society. Tuan-tuan dan puan yang semati sekalian, saya hari ini ingin mengucapkan terima kasih kepada MMA for inviting me today. I know that we've had engagement sessions many times. Once when I was Minister in charge of immunization, again recently when I was appointed as the Minister of Health. I think that one of the big agenda items for doctors, as raised by the President as well as our frontliner from Duchess of Kent and Sandakan, of course, is the plight of frontline of contract doctors, junior doctors. The Ministry and I are, of course, working very hard on this issue, and we hope that we can get a decent resolution and announcement soon. We're working very hard. We've already announced that contract doctors will be afforded equal welfare benefits and treatment in line with those of their permanent counterparts, especially eligibility to the equivalent of Hadiah Latihan Persekutuan for specialization. We also want to allow them to take turns on going on leave soon, once the situation is deemed manageable. And also, for those with excess leave, we have talked to JPA to allow them to carry forward this leave for next year. So these are things that we are working hard on. But I know, of course, the biggest issue is that of their position, whether it's a contract position or whether it's a permanent position. So we're still working hard on this, and I hope we can bring some good news soon. Doctors are, of course, doing their best throughout the pandemic, but I also want to take this opportunity on the World Mental Health Day to say that I'm also very concerned about the state of mental health of our frontliners. I think many are burnt out. Many of our frontliners are burnt out. Many suffering from post-traumatic stress disorder. Many are suffering from anxiety, even outright depression. And I think, you know, we have to not just make it accessible for them, but we must encourage them to come forward to seek help. You know that soldiers who go to war come back with PTSD. And we've always said that COVID is a war. So our frontliners are essentially soldiers who have gone through battle. So we don't treat them as soldiers coming back from the theaters of war, fields of warfare. Then we're not really understanding what they went through. Just as we treat soldiers who come back from battle and treat their PTSD, we must be able to treat our frontliners as well and care for them and to ensure that they have the help that they need. Today I announced that apart from, of course, the strategic plan for mental health, increasing access, we also want to develop digital tools to make mental health services more accessible to the public. Not just the phone numbers, but other more innovative tools that can be developed so that anyone with a MySejahtera phone can have access to mental health. And those without phones, of course, will continue to access our hospitals, our clinics, our Munkari centers for mental health. I also announced, and I don't know, not saying I heard the announcement, National Center of Excellence for Mental Health. We want to establish one where it will be not just for research, but the main center for referral, national for mental health. We really put it as an agenda for us going forward. So let me find the money for that. I mean, it's one thing announcing it, it's another thing finding the money. But I'm sure that, you know, if there's anything that we've learned from this pandemic, the healthcare sector deserves all the support that it needs from the government. All the support. Adding to the MMA, I'd just like to say thank you for the invitation today. You know, we've worked hard together on the immunization program, and I think we need to continue to work hard, especially with the private sector as well. That's why Protect Health is here in going forward. We've got immunizations for teenagers now. We want to start the immunization for high-risk people, elderly people, immunocompromised people, those with comorbidities, the frontliners, to get their third or their booster shot after this. So we increase the level of immunity for these people who are at high risk. That will need the support from our private GP friends. Yeah, we want to use the private GP network. Hopefully, we will get regulatory approval for vaccinations for children under the age of 12. Right now, we need to protect the high risk, the most vulnerable in our society, the elderly and those under 12. Number of cases of COVID for under 12 going up, about 40,000 if I'm not mistaken this year alone. Most of it light, but nonetheless, we don't know what the effect of long COVID, for instance, on children will be. And we want them to avoid getting infected in the first place. So hopefully, the children will be able to be vaccinated, hopefully sometime next year, and we'll give them that shield against COVID also. But also going forward, I need to sit down to talk to our private sector, private GPs, to also assist in home monitoring. As we move towards treating COVID at the hospitals and at the ICUs, because of vaccinations, the symptoms are milder or asymptomatic. What we want to see is more home isolation. But for home isolation, we also need people to monitor them in home isolation to make sure they don't get sick, to make sure that they don't fall seriously ill, just to ask, how are you doing? We can't do that in the government sector alone. We need the private GPs to come in to support us with the private CACs, with the virtual CACs. So we'll figure out something. We'll work together and share the burden, and we'll make sure the resources are available for private GPs to help us. And then we can start thinking about transitioning more towards what used to be normalcy for us. Jadi sekali lagi saya ucapkan terima kasih kepada semua, all the doctors in Malaysia. On behalf of the Ministry of Health, I would like to say, of course, thank you. Thank you for all your sacrifice and service, not just the last 2 years, but throughout these years, for taking care of Malaysians. But as we embark on a journey post-pandemic, I would like to also invite doctors to come together with us in care so that we can reimagine healthcare for the future. We're confronted with the burden of NCDs, greater disease burden in the next 10 years, aging population. We want to see how preventive medicine, predictive medicine can play a bigger role, not just curative care. And this requires us to reimagine our healthcare system. And I can't do that without all of you who are really at the forefront of delivering the duty of care to Malaysians. So happy Malaysian Doctors Day dan selamat menyambut Hari Kesihatan dan Prasmian. Terima kasih. Assalamualaikum warahmatullahi wabarakatuh.
A very big thank you, Tuan Khairi Jamaluddin, on behalf of MMA and all doctors in Malaysia, for everything you have done and are still doing for the nation. We would like to call upon Dr. Kokachai to present a fruit basket and souvenir to Yang Berhormat Khairi Jamaluddin, Dr. Salina binti Abdul Aziz, and Dr. Haji Singh. A big basket for Dr. Salina binti Abdul Aziz. Now check out the appreciation to Dr. Haji Singh. As we near the end of our program, I would like to call upon Dr. Kiruna Bukhara Suraju, the Honorary General Secretary of the Malaysian Medical Association, to give a few words, after which we will proceed to take a tour of our health screening booths downstairs. Thank you.
Thank you, Dr. Linet. We need to thank YB Menteri Kesihatan, Tuan KJ, for taking the time amidst his busy schedule to grace our event today. Today we are acknowledging the contribution of doctors towards the nation, especially during these past 2 years in battling the pandemic. Your presence here today, YB, will indeed be a moral booster for all the doctors, especially those on the front lines in our public and private healthcare system. Like anyone else, they too need the emotional support and encouragement, and this will definitely lift their spirits. As we transition out from the pandemic phase and living with COVID, it is important that while we have vaccines and the SOPs, We do not neglect the basics in maintaining health. The government cannot micromanage all of us. It is also important for us to self-regulate and to understand how important each one of us will play for us to prevent this disease. So look what. This is why MMA has organized the free medical camp taking place today to emphasize the importance of regular health screenings in achieving optimal health and to prevent diseases. We all heard the saying like what YBMK said earlier, prevention is better than cure. But we also must know cure is more expensive than prevention. We are also carrying out health screening under the PECA-B40 program, and we like to inform you YB, MMA has been working very closely with the Protect Health under the leadership of Dr. Anas, and in fact, the vaccination program is indeed a success. How a collaborative approach is in the public-private partnership. The last 1.5 years, MMA has been working closely, even though we may be local, but we have been working very closely with Ministry of Health on various programs and initiatives in managing the pandemic. In these efforts, MMA had raised more than 5 million ringgit for the various needs of healthcare facilities, healthcare workers, and even the public affected by the impact of the pandemic. With this, we believe more can be achieved on this collaborative approach on the way forward for countries' healthcare. Thank you very much, Ravi, and thank you everyone. Just one last photography on the Zoom. So probably those on the Zoom platform, you can turn on your videos so that the IT can take a picture of everyone for the record.